I generally like to get myself out of my comfort zone. I think that's where real growth happens, and it's hugely uncomfortable.
Hi, everyone, and welcome back to another episode of the Clinical Pharmacist podcast. My name's Ruhina, and I'm your host. And today, we're back with another episode of our new series, Entrepreneurship and Alternative Career Pathways for Pharmacists. As always, I'm joined by my co-host, Sarah. Today, we're joined by a very special guest, Nabila, someone many pharmacists will already recognize, and for a good reason. She's had a truly varied career and influenced pharmacy across several sectors. Her career has spanned community pharmacy, work as a GPhC inspector, director of pharmacy for a massive health tech company, and now superintendent pharmacist of a medicinal cannabis company. She's someone that I've met during my time working in health tech, and I've genuinely learned so much from her, and it's influenced the way that I have thought about my career. So I'm really pleased to have her with us today. Nabila, thank you so much for joining us. To start with, could you tell us a little bit about your career and how you got to where you are today?
Yeah, of course. No, thank you, Ruhina, for the invite. Yeah, I can give you kind of a brief overview. You've given a great snapshot of kind of where I've worked and stuff. I guess looking back on my early days as a pharmacist, I've been qualified for over 20 years now. Just for context, I started off in a hospital actually and found that kind of too rigid for myself. So didn't really like working within the constraints of the NHS. I found it quite stifling. There was a lot of structure. And now I understand and recognize why that was, because I just like to be kind of creative at work, I guess, but didn't understand it at the time. Moved on into community pharmacy once I left the NHS, because there were only a few options at the time that I kind of qualified that were accessible for the general population of pharmacists. So I moved on into community and again got quite bored quite quickly, essentially. So worked my way up to area manager in multiple, and then thought, what next? What's next for me on the cards? I just by chance saw a vacancy advertised for a GPhC inspector, and I thought, why not? What's the worst that could happen? Actually, if I apply and I don't get anywhere, then I've lost nothing, haven't I? I've tried. I can reflect on maybe what I could do differently in order to kind of succeed within that role. But lo and behold, I got an interview and I got offered the role. And it was mainly actually because of my kind of passion for services within the community sector. Again, this was kind of 10 or 15 years ago now when services were emerging and we weren't as clinical as we are within the community space now. So I was kind of flagged as someone who was a bit more forward thinking, I guess is the way I would describe it. So worked within the GPhC for a very short period of time. Again, realised that actually just wasn't for me because it was far too rigid in essence, but learnt so much within that role. So had exposure to so many different things, understanding more about kind of risk management, what the regulator looks for, and actually got exposed to a huge variance of kind of practice over things like independent, multiples, different sized pharmacies, different levels of incidence and the kind of proportion of kind of response that you might have to those kinds of things. Was ambling along within this role and was approached by someone from Babylon, which was a health tech company when I first joined. And they were looking for someone who had kind of some experience in regulation so they could support them through kind of quite a tricky journey in trying to get or normalize video consultations. So this is at a time, I think it was around 2015, 2016, when actually no one had heard of video consultations and the private domain was very much restricted to places like Harley Street or just an add-on to a practice that a kind of a clinician had. So it was a very new space for anyone to emerge into. And I remember at the time having lots and lots of conversations with people, clinicians, healthcare professionals, etc., around actually how we're putting patients at risk by consulting with patients by video, actually not being able to physically examine them. That was considered normal practice. And, it was actually considered dangerous by kind of people like the regulators, other healthcare professionals. And I guess what was different about myself and potentially other people that worked with us at the time, and I think when I started, there were about 40 employees, I think something like that. We really believed in it. So we kind of tried it ourselves. We were like, oh, wow, this is game changing. This means that I can have a doctor's appointment whilst I'm at work. I don't have to take any time off. It makes it so much more accessible. It means that I can get care wherever I am. And that was a phenomenal concept at the time. We absolutely believed point blank in it. And that means that we were able to talk to some of the resistance that we had to that change. And that taught me a huge amount, really, just having to have, I guess I would describe it as moral courage to stand there and kind of talk about what I believed in was the best interests of our patients. And the main reason I did that is because I absolutely bought into the idea. I stayed at Babylon for 6 years, I think, my way up to director of pharmacy there. And I think I had a team of 300 and something when I left. So all independent prescribing pharmacists, was super proud of what we achieved and what we built there. Really provided excellent care, I think, in primary care. So again, taught me a huge amount about health tech, things like working with MVPs, working with super intelligent people like those who are experts in AI and those who are software engineers and that kind of stuff. And learned so much from them with regards to things like project management, being much more creative. So kind of tapping into that creativity, being what we call agile. So really understanding that actually sometimes you have to pivot. You can't just be quite fixed on whatever route it is that you planned originally. Sometimes things fail and actually that's okay. So learned a huge amount there. Then left about 3.5 years ago, and I got a kind of quite sheepish phone call from our current managing director asking me to come and join him in a new venture, which really piqued my interest, quite honestly, more because something I didn't really know much about, so medical cannabis, but also because I just envisaged it being incredibly complex from a regulatory perspective. That complexity really interested me. So I wanted to really understand how to navigate that regulation. And also I saw some real similarities between kind of working at Babylon initially and working within the medical cannabis field, in that not a lot of people understand about it and probably don't buy into the treatment that we provide. And then just started that journey 3.5 years ago now. We started, our first office space was a porter cabin in Scotland, where I worked myself. Actually, it was just me, kind of this very remote area. And we're now located closer to home, thankfully, in the southeast. I now have a team of about 100 so far, but also we've got somewhere between 250 and 280 people within the organisation now. So in 3.5 years, we've been able to build a really great team. But I think the thing that I find most rewarding about this is the way that it impacts quality of life of patients. I get multiple bits of feedback from various stakeholders within the business or actually just patients themselves telling me how life-changing the treatment has been for them. It's an incredibly rewarding space to work in, so I'm really enjoying it right now.
Yeah, it sounds amazing. Like seeing your journey from where you started to where you are now, it's been incredible. And I think something that's been a common theme that we've had across this podcast series is every single person that was in a similar position to you has always asked, what's next? But it's always been that kind of risk that people have feared of, how do I get there? I'm going from a traditional job to this is completely different. And I think especially that jump to Babylon where you were doing something that was completely different. It's not been done by any pharmacist as of yet. Even with from Babylon to medicinal cannabis, that was at a point where no other company was doing it yet. And the regulations were so tight and new. Like it's not something that any pharmacist or any kind of company had gone into. So for those that are worried about taking that risk, what was your kind of motivation there?
That's a really good question, Ruhina. So I guess it probably boils down to mindset, I think. So I think the kind of approach that I take to different things. I think there's a couple of things that mean that I'm more likely to jump into something unusual. First of all, I think that failure is good. So I think that I learn much more in my failure than I do in my successes, because I'm able to go away, reflect on kind of what's gone wrong, and actually I'm able to then improve whatever it is that I'm doing in order to get better, essentially, kind of going forward. So I think that's one huge part of it. And I quite often ask that as an interview question if I'm kind of interviewing someone, because I'd love to see what kind of someone's mindset is around failure, because it really helps with that kind of growth mindset and mentality. And that's what really helps to kind of stretch you. I think the other part of it that helps with that is I generally like to get myself out of my comfort zone. I think that's where real growth happens. And it's hugely uncomfortable quite often. So you feel the discomfort sometimes. And I definitely have felt that at places like Babylon and actually here as well. But I know that when I'm feeling that discomfort, that's when I'm growing the most. So when I feel the most discomfort is when the most growth will occur. So I kind of give myself that reassurance that if I'm feeling in that space, then actually at some point I will see the results of that growth. So I think that's a couple of things. I think the other thing is another challenge. So I'm fairly creative for a pharmacist. So we've worked together before, haven't we? I like to challenge myself to be creative when it comes to problem solving. And I like to kind of challenge the teams to do that as well, because there's always a solution, I think. And again, I think that comes down to mindset, right? You know, if I kind of sit here and say, well, this is the solution that I've been presented previously, or kind of the traditional solution, and this isn't working, so there's nothing else that I can do. By having that kind of really open growth mindset and actually thinking that there's definitely a solution out there, I just need to figure whatever it is out. I think that helps to kind of stretch me and helps me to work in this kind of sector, essentially.
Yeah, I think actually that's one thing that's really stuck with me from working with you, actually. I think that there was a time where I was probably quite new to health tech, and I think I was feeling overwhelmed. And I think this is the importance of one-to-ones. And I always remember this advice whenever I am doing something new or uncomfortable with. I sat down with Nabila in Starbucks and I was like, I don't know if this role is for me or not. Like, what do I do? Is this right? Is this not right? And one thing she said to me was, actually, you're in the cycle of change now because you're growing, you're feeling uncomfortable. And if you can get through that discomfort, then you grow. If you don't, then you just don't move forward at that point. And I think that's a good bit of advice to a lot of pharmacists. And it's something that stays with me even today when I'm doing things and I'm like, am I sure I want to do this? Okay, actually, I'm growing, I'm learning. So I think there'll be a lot of pharmacists with a lot of like different career pathways. There's so many different options that are out there at the moment, and they'll all want to try something new. But from that discomfort, then they are growing. And I think essentially a lot of people get to that point, they feel uncomfortable and they drop out. But I think seeing that journey through gives you the biggest growth. And I think that's one thing that I've learned from working from you that still stays with me today. So thank you for that.
No problem. I'm glad it's helped.
I was just going to say, Nabila, obviously you were my summer placement tutor way back when. I was still
time ago.
Yeah, still at uni. And I find it funny how you've indirectly influenced two people that have ended up working together as well. And we've both had small sort of chats in the past, and we realized that we both knew you, and you have had an influence on the way that I think we think, or the way we train people, the way we advise people. I think I remember asking you for help and you'd be like, go look it up. And I'd be like, okay. So yeah, no spoon feeding there, but I feel like that's now made me sort of similar in the sense that if you go and do your own research and look things up, there's advice that I give, you'll find the answer. We can discuss after. And then, so it's sort of, it may not look like helping people, but I think it's helping people the hard way. And again, taking people out of their comfort zone, which works well.
But I guess you can't work in this kind of sector if you're expecting someone to come up with an answer for you. So being one of the founding members of my current organisation, if I had gone to my now boss and said, well, I don't know where to find this, I don't know where to find this, we would not have the company that we have today, because he doesn't know. It means that I need to go away and work it out. So I think there's a lot to be said about working, I would describe as autonomously. And I think that within this kind of space or within a space where you want to grow, that autonomous like working is incredibly important. And it's more of a coaching style and it's difficult. I completely agree. Sarah. It can absolutely be really difficult in the moment. And whoever you're kind of coaching, I guess, may not understand the value of it and now sometimes explain it because it can be quite difficult, particularly if it's a big ask. But yeah, I think that definitely helps. That approach is something that I also adopt, not just something I expect my teams to do, which is why I've been able to work in the sectors I have.
Yeah, and I think we kind of adopt that into our leadership and management styles ourselves, actually. So it's quite nice that actually it goes to show that mentorship and who you learn from and who you work with makes a big impact on who you are as a pharmacist, or not even just a pharmacist, in any career.
No, definitely. I agree. Yeah. I had some brilliant mentors when I worked, well, all throughout my career, but particularly at Babylon, I think. And I probably learnt the most from, well, I mean, I was the most senior pharmacist there and the first pharmacist there. So I learnt a huge amount from other colleagues, particularly kind of GP colleagues, but also those in kind of software engineering and other kind of parts of the business. Because there's a huge amount that you can learn. And sometimes it's really easy to just block yourself off from other people thinking this has got nothing to do with me. Actually, and I've been guilty of that in the past, but I know that I've definitely learnt the most from kind of observing, talking to, getting mentorship from people that actually are just in a completely different space from me.
Yeah, but I think it's also, like you said, you've learned from like AI implementations, developers, different departments. And I think that if you're not open to learning from these different departments, you're not going to grow. We work in such a different pharmacy model from where we used to previously be, that if you're not ready and prepared to learn these new skill sets, you will stay in those traditional roles and not be able to expand that foresight into these new or alternative careers, as we're calling them.
No, definitely, completely agree. And I think it can be difficult to see that, I guess, if you're working in kind of a traditional role, but it's hugely important to learn from other people. And I think whatever sector you're in, regardless of whether it's a kind of traditional one or a more non-traditional one, there's always people that you can learn from. So I remember actually working in community, one of my store managers, who was a non-pharmacist, actually was hugely helpful. Like he really stretched me. He really got me to think laterally, got me to think about other parts of the business. And this was in a supermarket. I didn't really care about selling tomatoes or bread at all. However, it was really, really useful. And actually now, again, my now line manager tells me that I've got a really great balance of what we describe as commercial acumen as well as that clinical insight, which again, a lot of clinicians lack. So just by spending some time with people who are a bit more commercial within a space that I was working meant that I was able to start building some of those skills.
Yeah. I was going to say, basically, advice is to just have people embrace what you do not think is part of your traditional role. If people shy away from learning new skills that have nothing to do with pharmacy, they're never going to sort of reach that position where they do become the pharmacist that can do it all, you could say, in a way.
I completely agree. But I guess I wouldn't even restrict it to non-pharmacy things. So having worked again in a community pharmacy, I was incredibly bored, like so bored. I reached out to the head office and was like, please just give me work to do. Like that was the actual conversation I had. Look, I'm really bored. My store is really quiet. I've got loads of capacity to do stuff. Just give me things. And I ended up working on their things like their SOPs and various other bits and pieces like that. And that was hugely insightful because it helped me to understand like kind of risk management, probably helped me with things like my GPhC interview, for example. But also, I think what was hugely valuable there is, and I think as a pharmacist workforce, we're not great at accepting feedback and we're not very reflective as a professional group. And I think that was this just kind of starting point of me starting to understand how important feedback was, but also understanding how to use it to reflect and then grow. Because someone going through your SOP and saying that you can add this and add that sometimes feels quite personal. But actually, if you think about the rationale behind them providing that information is to help make things more robust or help you to see a different perspective. I think when you shift your mindset to that, that's basically what helps you to grow.
Yeah, I completely agree. I think that if you want to be doing something not traditional, or if you want to go into entrepreneurship, then you have to be willing to take feedback, because without that feedback, you can't grow. I think I remember writing my first, was it the controlled drugs policy at Babylon? And Nabila must have sent it back to me 3 or 4 times to be like, have you thought about this? Have you thought about this? But actually, it changes the way you think long term. You have to be able to take that feedback and not be put off by feedback, because if you are, then you're narrowing your own like capabilities, really. So I think that is really important. I'm going to jump back now, Nabila. So we talked about failures before. I think there's a lot of people that are watching this that probably see the end outcome and see, wow, she was a director of pharmacy for Babylon Health. She is the superintendent of a medicinal cannabis company, but they don't see the hard work, the failures, and things that you have to go through. Is there anything that's kind of helped to shape you to do those roles? Anything that you just sits with you and you think that's where a lot of my growth came from?
So it's in a certain event,
Like an experience or an event or something within those kind of roles? Because I know in Babylon, it was probably the most regulated healthcare industry out there, because it came before anyone else. There were conversations that you would have had to have with regulators, GPhC, NHS England. GP at hand conversations must have been really difficult as well. What's one thing that you can remember that's really shaped you?
Yeah, I think there's probably a couple of things, I guess, traits that I possess and would kind of urge people to build on as well. I think resilience is incredibly important. So I think when you're undergoing change, when you're going through growth, it means that you do go through those like tough times, essentially. So having resilience and kind of understanding what helps contribute towards my resilience. So I know, for example, that if I don't do something physical at least X number of times per week, my resilience drops, right? So, like, it affects my mental health. It means that I'm not my best at work. So, I strength train a couple of times a week. That is a non negotiable for me, right? I might also go for a swim or something like that so that I can really just clear my head and understand and tackle the day with the kind of motivation and passion I want to, essentially. And that helps to prevent things like burnout and that kind of stuff. So I think resilience is hugely important. And I probably don't share this with very many people, and you guys may not be aware either. But I'm divorced. So I got divorced about 10 years ago, actually. So it was just before I started at Babylon. And actually, that was a life changing moment for me. So it helped me to kind of reevaluate everything I believed in almost. You don't embark on that kind of relationship thinking that it's going to end. And it was a long marriage. So I think I was married for about 10 years and in that relationship for much longer. So I think that really helped me to build resilience. It really forced me to reflect on what I believed in, what I wanted in life, what I wanted to achieve, what I wanted in a relationship, or what I wanted in life and work. And I think that really helped build my resilience, I think. So, and I've done a lot of work since then to help really understand more about myself, understand more about how I can get the most out of things. So, we talked about doing something physical, but also I know that I have most focus and attention, for example, in the morning. So, I know that if I've got to do something that's a bit more complex or requires a decision that I'm not entirely sure where to go with, I'm going to do that first thing in the morning because I know that's going to get the most focus and attention there. So it's about understanding what works best for you. I think also in our kind of roles, and I say that our because you're probably in the same boat as well, there's always more on your plate than you can manage on a daily basis, and understanding how to kind of prioritize. I think that's a huge work in progress, really. So I don't think you ever get to a place where you're perfectly prioritizing. It all kind of goes hand in hand where you're reflecting on whether you prioritize that appropriately, but also understanding that there's some priorities you're just not going to get to, right? Like, and just being able to accept that essentially.
Yeah, I think that is such a positive way of thinking, because actually from something that could change your life or something that did change your life, you use that as a positive way to reframe where you're going and what intention you want to have, as well as learn about yourself. And on top of that, you've made such an incredible career ahead of you based on that. And it's about not just about keeping a healthy mind, it's about keeping a healthy body as well. So this strength training, it all helps along the way. Before we kind of wrap up, there's a couple of questions that I've got. So I know your interview processes are really, really difficult. So for any pharmacists that are looking to get into the medicinal cannabis role or the health tech role, what kind of advice could you give them? Let's start with the interviews, and then generally, what kind of advice could you give them?
Yeah, that's a really good question. Well, I think if I'm interviewing someone who's changing sector, there's a couple of things that I want to understand that the person has thought about. So I want to understand that they've reflected on where they are right now and where they need to be. And there's always going to be a gap. Understanding that they have a gap on where they think that is. So I'll have an opinion on that, looking at their CV and speaking to them and interacting with them. So what I want to understand is really that what my opinion is doesn't differ hugely from what the person is saying, or that it's like a reflective kind of response to that kind of question. So thinking about what their biggest challenge or gap might be, kind of moving sector. I think where you're not able to reflect on that gap, that's where you get that, oh gosh, what am I doing type situation. And then that's where you get that either sink or swim situation, right? Where you either kind of sink because you haven't potentially reflected as well as you could have prior to making this decision, or you've thought, okay, you know what, this is going to be a big ask. And then you're able to put that legwork in and continue with that. So I think that's one big thing. I think for me also, particularly with this sector, there's a lot of stigma and judgment for patients, to the point of when I tell other healthcare professionals what I do as a job, I kind of get jokes, etc., about that's not a real job, or do you get free samples, and that kind of stuff. And that really, it's in jest, but it stems from stigma and judgment, essentially, because we as a group, as an aggregate, really don't believe in the benefits of medical cannabis. And I want to understand that they're open to learning. So I'm open to learning something new, but actually they're able to understand where their stigma or judgment lies, because we all have bias and judgment, and understand how they can prevent that from affecting patient care. So that's hugely important. So the last thing I want to see is that one of our clinicians has been judgmental or not been very open or not provided the best care to our patients. So I think that's hugely important for me, particularly within this space. I think the other thing really is mindset and, I guess, openness. So I want to see some signs of them wanting to grow, some passion, some energy or enthusiasm or drive, or something different, right? Because I want them to stand out to me. I speak to a lot of people with regards to roles and stuff on a daily basis, and it's quite easy for them all to blur into one, right? You know, I'm looking for that kind of like extra bit. Show me that you've got a bit more hunger or passion, basically, for what you're doing. Don't give me a generic answer about when you want to work for us. Just not going to cut it, I'm afraid. do some research, or make it personal, make it authentic, and make it genuine. So I think they're the three key things that I'd be looking for.
Yeah, I think that's really good food for thought, I think, for a lot of people, because we don't necessarily think about the stigma or the judgment that may come with those. And I think seeing that play out in a patient consultation can be quite traumatic for the patient and for us actually as clinicians as well. So I think that wasn't something that I had in my brain that you would come out with as advice, but I think that's actually brilliant advice right there.
You wouldn't think anyone applying for that job would be like that, hopefully, because hopefully they've done enough research to know what they are applying for. And it is a judgment-free zone to help patients live better quality of life, no matter what route they're taking to support with that. So yeah, everyone should take note if you're thinking of applying for these types of jobs.
Perfect. Nabila, before we wrap up, if any pharmacists wanted to find out a little bit more about where you're working or any vacancies that you've got available, where could they find out?
Yeah, so just by doing kind of a Google search on Alternaleaf or Montu. So Montu is our kind of overarching company, and Alternaleaf is a clinic that we provide care from. So just doing a search for that would hopefully bring up all the vacancies. We've got lots for pharmacists, but also other healthcare professionals, and it's a really exciting space to work in.
Brilliant. Thank you, Nabila. Thank you so much for joining us today and sharing your journey so openly with us. I think one of the key takeaways from this conversation is actually you don't have to leave pharmacy to have a varied, senior, and unconventional role. Sometimes it's about using the skills that you've already got in different ways. Thank you to everyone that's listening. We hope that this episode's given you something to think about and maybe a little bit of confidence to explore what your own next step could be. And we'll see you in the next episode of the Clinical Pharmacist podcast.